Hello, we are Aspire AI to stop opioid overdose. Opioid currently it is a crisis in the United States. Every day on the news you hear keywords such as opioid addiction, painkillers, this. Uh, it was declared public health emergency at 2017, and as you can see here, the rate of opioid overdose deaths are increasing rapidly, especially in recent years. This is a real life story. Christopher, 20 years old, a student, he had a minor car accident and he was prescribed opioid. So he was starting with 1 pill a day and he increased that amount to 20 pills a day. His behavior changed and unfortunately after 2 years, he's passing away. So this is a problem that people are struggling every day. So for this hackathon, our specific problem that we were trying to solve was finding patients who need help and are at high risk for opioid overdose. Our solution is based on using AI on EHR records for early detection of such cases. What we are doing, we have access to a real data set, 100,000 real patients. It is anonymous, time shifted, de-identified, so we can use that for research purposes. We have access to diagnosis codes, procedure codes, medications, lab results, and clinical events. We are using a deep learning approach. Deep learning is a very strong algorithm to find complex patterns from data, and it is better comparing to traditional machine learning methods when the amount of, it scales better when there are more features and more amount of training data available. For our results, we got very good results. So the model performance that we trained on this hackathon, we can detect 86% of these cases with very high precision. These are some features that the model was detected automatically from the input data. I can get back to it if you're interested. So this model should go in the EHR systems, in the hospital, in healthcare systems, and embedded in the dashboard of the physicians. So these are some screenshots of a potential model that can be integrated into EHR. Then after our model detected these cases, healthcare providers and social workers can take better care of these patients to prevent opioid overdose. And at last, for our business model, we are thinking about starting with an innovation partner, a hospital like Stony Brook University, Mount Sinai, to have our alpha release. We scale that to VA and Mayo Clinic, and at the end, we are targeting for EMR and EHR systems, which are huge, like Epic and Cerner, and pharmaceutical companies. Thank you very much.
First, I love the fact that you actually built a model and trained it and ran it. It's hard to do that in any kind of hackathon, so props to that.
Thank you.
I guess my major question, though, is that I'd like you to talk a little bit more about your business proposition, like who pays? You know, why would Cerner, for example, be wanting to pay for this, or Mount Sinai?
So I think using AI for detecting such problems, it is getting a hot trend right now, and it is getting real-world applications. And many hospitals, for example, I know Stony Brook University, they are starting to use these applications in the real-world hospital system. So because they want to be in the competition, and for them it costs, for example, a few cents per click. So the cost it is going to be, it is not on patient's side, it is on EHR systems and physician side. So but because the cost on that side I think could be very little per case, it could definitely help them to, for example, for pharmaceutical companies to prevent lawsuits and early detection of a specific drug that is causing a problem.
So can I ask you if you have any sense of how close to a catastrophic event would your algorithm identify the case? Because you know, if you identify it very early on, there is a lot of room to do something. Mm-hmm. But if you are at the very end of the road, might be a little bit too late. So do you have any sense of?
That is a great question. For this specific hackathon, we used dense neural network, which we didn't actually estimate the time between the encounters, so how we created our matrix, but it is possible to come up with an estimation of when it is going to happen. It needs more work on the model side.
One quick question. If I understand this correctly, this depends upon the potential overdosee having some sort of interaction with the healthcare system.
Yes.
Do you have any information on how many of the folks who are actually overdosing have that kind of contact with the healthcare system as opposed to being completely out of that system? They've had their initial interaction with the healthcare system, and now they're into the black market for drugs.
Okay, in many cases that we reviewed, it started with an accident. It started with just a decent drug for, covering the huge amount of pain. And it wasn't like, and because getting access to these kind of drugs, it is getting harder every day. So they are starting from EHR systems and getting the prescription from doctors.